Hello and welcome to this King's Fund online event on digital inclusion and public services, kindly sponsored by IBM Watson Health. My name's Matthew Honeyman and I'm delighted to be joined by this wonderful panel today to discuss this topic. So to begin with, we have Kwesi Afful from the North West London collaboration of CCGs. Hello, Kwesi. Alicia Davies from Public Health Wales, Lydia Nicholas from .Everyone, and David Farrell from IBM Watson Health. And just before we launch into the discussion, I'm just going to talk a little bit about our format today. We're going to have a very quick discussion around that will allow our panel to introduce themselves to you and to each other. And then we'll come to the audience for a discussion, which is one of the best parts of these online events. So you're able to ask questions of the audience and send in your questions throughout the afternoon, and I will put them to the panel and we'll inject some other perspectives as well to the debate. But first, I'm going to come to you, Kwesi, to ask you the kind of starting question about this, which is what we understand and mean by digital inclusion and why it's important for you in your work.
And the way in which I understand digital inclusion, I suppose I would break down to three different sort of areas which we've noticed in North West London. So it's digital skills, connectivity and accessibility. So with digital skills, everyone being able to use computers and the internet, it's very important, but really a lack of digital skills is not necessarily the only or biggest barrier that people face. And with connectivity, access to the internet, that's a massive issue in North West London, and the variants of such. People really do need to have the correct infrastructure to be able to get access to the internet, but it's only the start. And then accessibility services should really be designed to meet users of all levels and from all backgrounds, and that's where I suppose our inclusion really tries to focus in. And the reason why it's so important is because I'm the program lead for a digital citizen and education program, which is largely supported and driven through volunteer digital ambassadors from around North West London that we train. So they focus on trying to go out and educating as many of the 2.5 million people we have living in North West London to understand just basic things around quite key health digital tools, and that incorporates a digital healthy schools program, going to our care homes as well, also our workforce as well, because if the workforce don't understand about digital, then no one's going to be using it. And then we also focus on widening digital participation, which is something which we are working on as well.
Okay. Alicia, how do you understand it and why is it important for your work at Public Health Wales?
It's a really important question, not just for Public Health Wales, but public health across the UK and further afield. Mm-hmm. The context for me is the biggest question is that the use of technology really varies across the population. Some of the points that you were making, but there are many other dimensions to that. And that we risk potentially with a focus on digital solutions, excluding those that aren't on those platforms or engaged in that way. So, and the challenge from a health inequalities perspective is that often those that don't engage or aren't interested in engaging may well be the groups that actually have the greatest need. So if we don't want to inadvertently increase inequalities through a digital inverse care law, well then how can we prevent that? And some of the solutions you mentioned, and there's a few others I'm sure we'll come back to in a minute.
Yeah, okay, thank you. Lydia, how about you at .Everyone?
Well, to me, exclusion in digital platforms is very much like exclusion elsewhere. It's fundamentally about power and representation. So the groups, the needs of particular kinds of social groups get prioritised or understood or centred in all sorts of innovation, and then those of other communities or other populations are not. I mean, I had this isn't always about kind of conscious isms. I had a great conversation just before coming on camera here about the different kinds of accessibility issues that affect people as they get older. Just that statistically, all of us will, as we get older, get drier skin, get worse, get poorer circulation, and lose muscle mass in our hands. And that just means that it's harder to press buttons on a smartphone screen, for instance. If you just do not consider the needs of tech-savvy, capable, but beginning to lose strength and like connectivity in their hands people, then you're not going to make things accessible to them. And that connects up very much to our work in the Better Care Systems project about what kind of connected care future do people with physical and learning disabilities and older people with access needs actually want. And like, as you say, we thinking about just the digital risks, forgetting that basically all solutions have both a digital, like any digital solution has an offline physical element, even if it is pressing that button to sign up, even if it is making sure that the Wi-Fi hits the corner of the care home that somebody is trying to work on a shared record with a resident with. These are physical spaces. People have physical needs and physical distractions, and they sort of don't leave their cultural, political, and like socio-economic identities at the door when they're trying to access these services.
Yeah, great, thank you. And David, just come to you last but not least.
Thanks, Matt. So my focus is on working with government agencies worldwide, and specifically those who deliver social programs to build better digital services. I think in that context of social programs, when we talk about inequality and inclusion, we're often talking about giving the people who are in need of help and support the same chances in life as those who aren't in need of help and support. So making sure that everyone has the opportunity to fulfill their potential in life ultimately. But even within that group of people who need help, there's lots of divisions of groups as well. And our customers and the agencies that I work with are really focused on making sure that all of those different groups get the same chance themselves. So, for example, not everyone has the same level of mobility, not everyone has the same level of literacy, not everyone has the same level of computer literacy, not the same level of eyesight, some work, some don't. So all of those different groups need to be considered and designed for. And so I think when I think about digital inclusion, I think digital services have the power to help all of those groups if they're done right. And that's a big if, because if they're not, then you're in danger of going the way that Alicia was saying, where you have the opposite effect to the one that you wanted in the first place. So that's how I think about it.
Yeah, okay. And so when we're thinking about designing for these, I would like you to invite you guys to talk about some of the examples from your work where you've, or that you know about from elsewhere, about how people have I don't know, rectified problems where people are being excluded, or places where people have kind of built that in from the very beginning. So who would like to go first? Kwesi, are you?
Yeah, sure. So I can give a very live example. So with the digital citizen education program, we are essentially going out to recruit volunteers, those either that have worked with practices or the NHS before, or from established organisations. So for instance, we had a member of our team go to Harrow Mencap because we know that those with learning difficulties and disabilities are excluded, and it's just assumed, well, what are they going to do? What are people that obviously have learning disabilities, what are they going to do with regards to digital health? But making that assumption is essentially the beginning of that exclusion, and thinking, well, would it really benefit these ones? And I think it comes down to, even before that, it's us trying to be human with one another. And so when our member of our team went there and said, we would like to just do a free training with you guys, sit down for a couple of hours, it was really beneficial. It was excellent. And we had people trained there that are now going to train others on obviously digital health, and they were actually able to give us feedback on the way in which you're delivering that's not very easy for me to understand. You should really think about simplifying what you're doing, and speaking less, waffling not less, and being more concise. So we were able to get some excellent input from maybe a group that historically has just been sidelined, and that's what we've tried to do, concerted effort to try and engage with those that are forgotten, because our whole ethos is that we don't want to leave anyone behind, no matter how long it takes. We want to try and bring everyone along for the journey.
Yeah. And so what kind of methods and approaches do you use to bring those in? Are there things that we can point people towards and tools and results?
Well, essentially, everything that we've done in North West London, we've tried not to reinvent the wheel. So we've gone to look at the Digital Inclusion Guide for Health and Social Care, which was produced by Bob Gann. We've looked at understanding patient data. We've looked at health education in England. We've brought together all those sort of things and also the local nuances to create a programme which would be able to deliver effective digital training and education and inclusion, but also to try and do it in a way in which people in the localities would be able to respond. So we're trying to use a lot of the national tools and frameworks and localise them, as it were, and actually trying to put them into effect, which is, it varies, and we've had varied results, but we've only been going for about 4 or 5 months, and we've got a nice cohort of people, ambassadors from different backgrounds trained up. We have about 82, which is really good, and we just want to have more and more. We want to have 300, 400, 500 people going out and just delivering a very brief session with someone, showing them this is what an email address is. Something just like that even, and then seeing how that as an ecosystem or as a movement can really help, I suppose, the digital inclusion and digital literacy or maturity of an area.
And Alicia, Public Health Wales and...
in Wales, a lot of there's the same type of work happening, again reflecting on Bob Gann's work. There's informing within Wales, there's Digital Communities Wales. They're doing a tremendous amount, especially in that peer-to-peer support for digital inclusion and across generations, so bringing in younger groups to actually help to upskill the older generations that are in, I think there's some examples where they're working through care homes actually to try and extend that reach into digital inclusion. And that digital inclusion isn't just about health. So whenever we're talking about public services, it's inclusion. Actually, are there examples where it can extend out to access to housing and employment and all of those other things that have a indirect impact then on your health? There's a couple of other examples from NHS Digital here in England. There was one that was talking about how to support homeless populations. And again, those preconceptions of homeless populations don't have access to mobile devices, or what's the point in trying to do that? But actually, there was a tremendous amount of engagement and support and ask for that. For that, and that the small study that was done with homeless populations really valued it as a way to getting access to information about where they could get food, where they could get free access to healthcare services. So I think it's about thinking about where are the opportunities where we can really use some of that digital tech to help address some of those inequalities in our society. So not shying away from that progress, we can't, but really capitalising it, but just bearing in mind how can we make sure everybody can benefit from it.
Right. Lydia.
I'm going to sort of twist it around a bit and kind of talk about how digital work can sometimes be a problem and the fix can be offline. Just again, kind of bringing things back to power and understanding of different communities' needs and expectations. So there was a programme that ran for several years, ended last year, in which the Home Office was fining hospitals that did not share information about migrants that were getting medical care. Now that it's one of those kind of cruel ironies that one of the few ways that it seems that data is always very easily shared in the health sector is when the Home Office is demanding it. And that meant that a lot of people were deciding to forego necessary medical treatment to the point that there were stories of people leaving cancer untreated and eventually dying, or not turning up to prenatal services in a way that endangered both mother and child's health. Now there was quite a large online movement against this, flagging up the work of Docs Not Cops, and that was ended. But the idea, I think, that I kind of want to centre there is that sometimes when people aren't engaging with your digital service, like we've heard about a similar kind of issue with people in interviews telling us that they don't sign up to social prescribing services in their area, not because they're not digitally literate, but because they're pretty convinced that if they do, the DWP will see that they were involved, and therefore if I turn up to this sort of social event, will that mean that they believe I'm not depressed anymore? Even though turning up to these kind of events and reconnecting with the community is the exact way to, is one of the better ways to kind of bring people out of social isolation. So we very much heard that people were not engaging for very good logical reasons. I mean, and this is not necessarily just this isn't necessarily just a question of people who were who's did not have legal status in this country. People could be very concerned, even if they were in the process of reapplying for a visa or they had family members they were concerned about. So in that kind of case, that's one of the few successes that I've seen. But in interviews and workshops, I've heard a lot of people talk about how some of the systems that they encounter are actively hostile. That you can try and sign up for your DWP assessment and be told it's an accessible building, but when you turn up, the floor that the assessment is in is not actually on the accessible floor. Everyone's nodding in kind of recognition, and that is counted as you not turning up, which means that you can get sanctioned. These kinds of systems like that is not a very difficult fix. Yeah. I mean, I spent years as a web developer. I know that education about accessibility, like basic accessibility in websites, is not particularly sort of well grounded throughout the industry, and it's not a very high priority. But that kind of fix is a pretty easy look up. Like, is the room in an accessible thing? So I just want to kind of flag up that a lot of the time people aren't engaging for very good reasons, and the kind of outreach that one does can't be limited to just, this is a great service, and if you knew about it, you would absolutely get involved. And that's what I'm sure these community volunteers are dealing with, exactly these kinds of problems. And so long as they're able to bring those concerns back to you, and do that structural reflection, that kind of work is extraordinary. But when I see so much public engagement about inclusion that is just, telling these people we have something good, and then the only reason they're not signing up is they can't use a mouse.
Right. So it's kind of busting that myth that it's about just digital skills. There's often people who are really clued up and
really quite sophisticated thinking going on, and sometimes it's not correct. I've been doing focus groups recently about online harms and fears there, and sometimes people have sophisticated models of what's going on that aren't correct, but that kind of folk understanding is all they can access, because we know that it's often these systems are often a mess, and we're often being actually lied to by both companies and government about what's being shared. Not in a kind of horrific conspiracy theory way, but so yeah, that as a social movement driven primarily online, I see as a great success that fixed something and a sign of a lot more that needs to change.
David, I just wanted to come to you. You work in industry. How do you kind of deal with these problems as and when they arise?
What I've seen work is when, and what I think we need to stay focused on as well, is when people do come, as Lydia was saying, if we say we've got a great service for them to come to, we have to make that stick when they do come. And the way that we can do that, I think, is through design, and designing those services in a way that are inclusive and human-centered and intuitive and all of that good stuff. And one place where I've seen that work with one of the agencies that we work with is in New York. We've been working with the Department of Social Services there, who deliver means-tested benefits to over 3 million New Yorkers. And a couple of years ago, they made a commitment to move from a face-to-face model to one that was driven primarily through digital channels. Excuse me. And they did that really for two reasons. Firstly, they wanted to reduce the amount of time that their staff was spending dealing with what they would call the more straightforward cases, and allow their time to be freed up to deal with more complex cases. And secondly, to really improve the service that their citizens were getting, be it digital or face-to-face, to make sure that they're accessing the services that they require. And in doing that, when we went to New York to see the way that these people were accessing services, you You would see, for example, a single mother having to come into an office with 3 kids during working hours, because that's the only time the office was open, to sit down at a PC and conduct the online application with somebody looking over her shoulder to help. And that's not the experience that is going to encourage them to reuse those digital channels. The Department of Social Services say that the vast majority of their clients only access the internet through a mobile phone. So the challenge for us was working with them to make sure that we designed an experience on the mobile phone that was as good as anything that they're receiving elsewhere, including in the private sector. And it's a real design challenge, because applications for social assistance aren't known for being short and snappy. Like, they often require multiple pages of data entry. And for a long time we questioned in our own organisation whether or not people would ever fill out lengthy application forms on a mobile phone. Would the technology ever get there? Would people really ever want to move away from speaking to someone? But what we've seen in New York has shown that will happen, and it can happen. And they've seen a 50% reduction in people coming into their offices to apply face-to-face now, because they now have an application that they feel more comfortable running through on any device, including on a mobile phone. So I think the importance of designing those experiences with your users to make sure that when they do hit them, they will stick, and they won't bounce off that digital experience, and you'll lose them for another 2-3 years before they come back again, is really, really important.
Okay. Alicia, you had some work from Wales recently published about the survey that you were talking about, and that covered smartphones and kind of establishing things that we may not have had from the evidence base about how people use them for health purposes. Do you want to say a bit more about that?
Yeah, sure. We in Public Health Wales, we carried out a survey last year, a population survey. About 1,200 people responded in Wales, asking how people are using digital technology, because that could be a phone, an iPad, their computer, online, to engage and support their health or monitor their health. So wearables were in there as well. And the purpose was to try and better understand those social differences in across populations in Wales in using technology. So 2/3 of to start, actually, the first problem was is the connectivity. So we still have about 10%, or 1 in 10, that don't have access to the internet at home, in Wales. And then of those that do have access, about 2/3 are actively engaged in using technology to support their health, and largely that's about finding information about health services or activities to support health. But we also find there was about 1/3 that were using information online to self-diagnose or try and find out information about conditions, and about 14% were trying to book or have booked a GP appointment online too. About 10% were using it to monitor meds as well, medications. So there's a huge breadth of different areas that people are using it for to support their health. But actually there's really stark differences. So it tends to be more women than men, but we find that in all things health. It tends to be more younger people than older people that are using technology, but it wasn't excluding older groups. So there's about 25% of 75 plus year olds, and there was no upper limit in that, were engaging with technology in some way. And then stark differences depending on affluence, so really a lot lower in more deprived groups, and a lot lower uptake in people that have health harming behaviours. So we class that as a current smoker, drinking alcohol, physically inactive. And from a health perspective, they're the very groups that actually you want to engage in health. So thinking about those digital solutions is going to require some thought about how you can co-produce some of that to meet those needs.
Do you think the kinds of tools are out there at the moment for example for your population, but you know the kinds of things that we'd want people to be accessing through those channels, are they out there, or do they still need to be built? Might that be to speculate behind some of those numbers?
So the biggest challenge is the presumption that just giving information will lead to a change, and we know it doesn't. So we need to better understand what motivates people and why people are engaged or not engaged to getting online and that type of information. And there's the NHS App Store, where they're starting to evaluate and look at the effectiveness of digital apps. So there are some there, but you just can't keep up the pace because the production of apps is tremendous. And then there's really very little out there that tries to understand are they effective in the same way across different groups. So we're doing a piece with yourselves at the moment at the King's Fund, looking at that question about are there studies that have had a look to see can digital tech be used to address those inequalities, and really there's not much out there at the moment. But the one thing that might help is within the NICE evaluation guidelines, there's on digital technology, there is a pointer in there or a hook about just trying to understand what are the differences across different groups whenever you are evaluating programs such as that.
So I'd really like to bring in the audience questions now, but I think there's already some of the same themes that have been coming up in the discussion, coming up in our question. So the first one I'd like to deal with is Adrian Descent, who asks, how can we ensure an emphasis on co-production when designing new digital services? Which I think we've talked about, but this kind of word of co-production is perhaps some kind of solution or some kind of method to embed in the design of services. Kwesi, I wonder what your thoughts on co-production.
So co-production is an expression bandied about, and people sort of say it to sort of say, well, aren't we clever? We did co-production, but I think real co-production is before you've even thought of the product, not even before you thought of the product, but what the end product's going to be. You know, when you've got an idea, that's when you need to be bringing in. And I think what's very interesting is that you reference the NICE guidelines, and they speak about co-production. They speak about having patients, residents, citizens involved at the beginning, not a few people locked away in a windowless room in the ivory tower saying this is exactly what our population needs, we're going to do that. And what we'll do, we'll create it, and then we'll get their opinion on it. Because that opinion could be, well, this isn't what we need, but then you say, well, we've actually built it now. So what we can do is take on your points and then make an iterative. And that's what I think the question is about. It's about how do we get away from the tick box of co-production. Now, I have to be honest with myself that I've been succumbed to that. I have been involved with a project where we had something, we created it, and it was like, oh, we'll go and get the opinion of public. And you really can see that when that happens, people will not use the tool. It's as simple as that. So you think, oh, this is going to be brilliant. We'll get people's opinions. Get some people, oh, this looks nice. And then you think, well, we should pat ourselves on the back. But then you look at your usage. Now, we had that with the Patient Online project. So it's a national project. Everyone have the ability to book, change your appointments online, get repeat prescriptions. And what was really interesting is that at the end of the project, we chuffed with ourselves. We had 870,000 accounts across North West London. So we were like, over a third of the population, oh, we've done brilliantly. And then when I looked at the reports, the usage was something like 4 or 5% of those accounts were being used each month. So I think getting away from this, sort of, let's just create something, push it out, promote. People then use it. We'll see activity reduce in, places where we don't want high activity to be. And people all use that, and then everything will be brilliant. And because of that sort of, head in the sand sort of thinking and planning and designing, these tools don't end up being very effective. And then you have to do a sort of retrospective sort of adjusting and speaking to people, engaging to drive up that usage. So I really do believe that what needs to happen, every organisation, whatever organisation you work for, at the beginning, you need to get users in to say, this is what we're thinking of. What could it look like? What's important for that to be brought in? And it's not going to always be a comfortable discussion, but we have to be grown up enough to say, you know what, we're going to take that on board and actually create something which not only people want, but will actually benefit people as well, rather than creating it, pushing it out, advertising, and hoping for the best, because that's poor commissioning. And that really isn't servicing the users. And that's actually undermining the intelligence of the people that we want to actually use a tool. So I think try to move away from the tick box as early as possible. Getting people involved for co-production should be mandatory on projects.
It's kind of moving away from that paternalistic, we're engaging you on a decision we're thinking about making or we've made about you, to something that where you embed devolve power to communities to make sure that they are part of the decisions in the first place. But it seems like that might be quite challenging for public services in terms of devolving power and involving people.
It's a change in working because we don't normally do that. We sit away at our computers, tap away, have a project meeting. We need to create this now, and we need to do this now. Let's do it, and then we'll, that's exactly what's going to happen. We're going to see that shift, but it's the assumption. It's the, preconceived ideas of what people want or how they'll use a service, and not understanding. Well, I think the point was excellent that you made, which I'd never even thought about as we age, dryness of our fingers, that obviously our eyesight, and how that can impact, how that could be used. So things like that, you need to do your homework before you embark on a project, especially when we're trying to deliver public services in the 21st century. You need to be fit for purpose, and no one's got any sort of massive pots of funding, so that money needs to go a long way. So if we do it properly at the beginning, then you really will get the quality of service and get that uptake, which will lead to the benefits and reduction and savings.
So anyone else have experiences with co-production or as an idea, or in some of the work that they've been doing?
I don't design public services, but I do interview people about their experiences of public services, and I'd just absolutely echo what you've said. And I think one of the kind of tragedies is that it's very, very hard for local authorities, no matter how, or commissioning groups, no matter how much they want to be part of this, to have any kind of flexibility given the current funding and workforce crises. So actually having that open conversation is sometimes going to end up in a really painful place as people say, well, this is what we need, and there's very much, well, that isn't what we have capacity to deliver. I do think that in the long term, investing in that way, and also always investing in, I'm very much about investing in and trusting the skills of frontline workforce, and also kind of your champions, your volunteers, your expert patients, your families, because a lot of the time what you actually need is, as we get more technology and more complex, very streamlined services interacting, you actually end up needing more creative and complex decision making at the front line, not less. There's a lot of the time there's this feeling, we've created this perfect streamlined service, or we've created this beautiful app, so now we don't need the people anymore. But actually, on the ground, getting those things to work together, getting that to actually fit into the messy reality of people's lives, involves a lot of creativity, involves a lot of communication, involves a lot of flexibility. And that is how you solve root cause problems. That's how you have the light bulb moments that say, oh, this service... I've had these conversations with people that say, well, I was having a district nurse come all the way out to my house to change a bandage all these times, and it was taking an enormous amount of their time, and it was very awkward for us because it meant that we had to make sure that people were around to open the doors for months. And then it turned out that actually there was this support group that was just down the road that people would meet up, and a district nurse would come along and they could look at everyone's bandages all at once. And you needed that creative, you needed to respect the intelligence of the people at the front line. You needed to listen to families. You needed to have service designers and producers talk to each other between different public services, between even public services and industry and third sector. And that's so hard right now. Commissioners and local authorities absolutely have my sympathy with if you are under so much pressure, how do you find the space to have those conversations? But co-production has to be a continual thing, get people in right at the beginning, but also keep being able to have those points where people can put their hand up and say, actually, could we link these things, or actually could we think about this change? It's a bit like, I'd sort of like to flag up some of the work that other people at .everyone have done. There's this Tech Transformed project that Sam Brown there has created, which is about like injecting moments of reflection within the design process that keep coming up, so you have those chances to have that conversation. So those tools are available for free if anybody wants to look at how you can get those moments into your process. But yeah, in many of these cases we need to spend in order to save, and that's very hard to consider in this political environment. So, you know, structural reform the whole way through.
Echo some of the kind of work of some of the big scholars in the digital change literature, like Trish Greenhalgh, about how we have complexity is one of the reasons that we don't, for non-adoption of tech in healthcare and in other sectors, and the way that we kind of have lots of incentives to assume that away, whether it's financial, whether it's other kinds of organisational and cultural things. I'd like to move the discussion on to a question that came in from Wendy Kilman. I think that's the correct pronunciation, but she asks, how are sectors working together to improve digital engagement? So I think this is a really interesting topic here about, we talked a little bit about kind of general digital skills and the kind of need for them, and different sectors of the public realm are kind of thinking about how to apply digital solutions in their area. So in healthcare, we've been talking about that. There's a risk that this kind of falls through the cracks between government departments, or between, or kind of assuming that any one government department is responsible for this, or whether this is something else in nature. So yeah, have people got experiences of that, and kind of thoughts on that, about where cross-sector collaboration's happening?
So essentially, that's what I think myself and my team have been trying to do for the last sort of year. And you know, as has been commented, the different pressures which are under, you know, council, different NHS organisations, you know, the education sector, very much it has to be a whole system approach. There's no point in me saying, okay, so to stop you from going to A&E unnecessarily, you need to do this, and that's all we focus on. We need to sort of focus on the linked dependencies and issues. So, you know, this is why we're trying to work with education in North West London. And, you know, quite honestly, we said, right, we're going to pay for a platform for all of the secondary school children to use. And it will just give them lots of more information about safe apps, you know, how to deal with WhatsApp and WhatsApp groups and being bullied, and people, you know, sharing inappropriate photos of you, how to deal with it, or physical health. And what happened when we first launched the program, we thought all of the schools were going to sign up, and we had like 5 out of 120 that did, and a lot were just not unwilling, but you know, it would just take such a shift in the way they work to engage with us, to try and join this piece of work up together. And again, you know, that's why it's not a I'm quite keen to sort of speak about things which we haven't got done right so far, because I think that transparency is what helps us to learn. So I had to actually think, wait a second, how should we be engaging education properly to do this? How should I engage the councils, because they're stretched? Well, it was very much, we've got some funding to do education, let's work together as a system to do that. And not just those two, but think about how the fire service as well. And people are like, well, why would you even bring in the fire service? Well, the fire service conduct checks in people's homes in terms of safety, which can be very helpful for social care. Doesn't benefit any of my objectives or my, you know, personal plan, which I have to get signed off by my manager. But again, it's where we need to be. It needs to be a whole system. Everyone has budgets or objectives, but again, it goes part to that thing I said at the beginning about us trying to be human first, and also trying to see, all right, we've got a little bit of money, let's try and do something holistically, whole system approach, bringing in voluntary care services. Point you made, if you've got a district nurse going to different places, if there's a nice, you know, user group or a support group that they all go to, what can we do to make it safe for the district nurse to go there and deliver that service? Because then it would save on time, but everyone will be around a more comfortable environment as you'll be treated. So it has been very challenging, and it requires patience. And I really do want to tip my hat to all of my colleagues in councils and education that have worked with us over the last year and a half to try and bring together like a sort of a digital ecosystem in terms, or just an ecosystem or movement of trying to do things together. Because if we can do things together once, then we would be much more likely to be successful in including many more areas of the population.
Alicia.
I'd second that about it needing to be, it's cross-cutting, and cross-cutting across public sector, but also cross-cutting into other industries and partners too. And we're not going to get there from a public sector perspective without, that link and those challenges. At a policy level or a strategy level, I think a lot of the different agencies are on the same page. They want to look at how we can use digital tech as one of the solutions, but recognising hopefully that that there needs to be that delivered along with other solutions, because that isn't going to be the one approach for everybody. It's understanding what the value that brings to each organisation. So if that's the fire service, the social services, the health services. So understanding what your partners can potentially see as a value and using that as a driver to them working together really helps. But your partners in that mix are also the members of the public. So there was a survey done by the ONS, and the ones that don't engage with technology, the most common reason, was about 64%, was the view that I don't need it. Why would I bother? So trying to make sure that early engagement and that co-production element is in there is really important. And then the last thing would be about keeping it simple. So don't try to jump automatically to the most complex systems. Some of the easiest systems might literally be giving some space in the local community where people can come and peer support each other. And there was a nice example recently where actually out of that in a local community that there was a digital diabetes self-help group. Nobody went to the community and said, I think we need to start a digital diabetes self-help group. It just bubbled up that way, and I think helping to support some of that doesn't always need a really complex solution.
Sorry, David.
Briefly add on. I think there's as Alicia alluded to, I think there's a role for product and technology companies here as well to help identify those commonalities across sectors and help bridge them, because there are commonalities that down at a very granular level about how we design our services, but also as we come up levels, the processes that they share and the look and feel and the way that those services are delivered, the technology that we use to deliver them. Many of those things can be common across those domains and those sectors, and that's what I see as being the role of product and services companies and technology companies to help bring that knowledge that we have from working both with government and outside of government as well, to help bridge those gaps and increase that standardization so that you have that kind of single view as a starting point across your domains.
So another question that's come in from Richard Denyer Buick is a question about this idea of the work that we need to do on digital inclusion, and whether it's something that's specially provided, embedded on, put on top of the kind of work that we do in terms of building and designing digital services, or is it something that needs embedded as an approach throughout those things? Are there? I guess these kind of getting at the question, like, do we need programs like the widening digital participation scheme? Do we need them expanded? In future, or is this something that is done through that approach and an inclusive approach?
I'll just speak briefly to an example that Lydia brought up earlier, which is accessibility. I totally agree with you. Like, we're not even doing that really well enough across the board already, and that's a very, very basic thing. Allowing everybody, regardless of their, physical ability, to be able to access services through the internet. It's really incumbent on us to build in accessibility to all of our tools in a way that treats the people who will be using accessibility tools exactly the same as anybody else. I've seen it be an afterthought. I've seen it be that, oh, that'll be the last thing that we test. If we aren't prioritising the testing of that very basic thing and baking that in from the word go, then we are automatically excluding people from the word go. So, you know, it's a very basic thing, and I think we have to start with the basics and bake them in before we go up the layers.
And I think that often accessible, like thinking about accessibility in your product makes it a better product. I mean, at the most basic kind of coding level, thinking about how your page will be read by a screen reader will mean that you will probably organize the content in a more logical and elegant way. I can see the other person that's written some code like nodding. And if you're thinking about how your service will flow from like one stage to other, like one of the I'll flag up the work by Scope, their big hack project at the moment that is looking at crowdsourced accessibility reporting tools that will be able, so people will be able to say there's a problem with this site or this service. In those kind of things, which I think that I think will be great as a tool to like call public services and mixed services into account, or to account. Sorry, like if you book a hotel room in a place that says it has accessible, like wheelchair accessible rooms, a lot of the time that doesn't actually mean that when you get there that room is available. Like that kind of, how do you look at that whole system? And that, which is used as a case study often, like feeds into things like, say, the DWP deciding to put its assessments in a room that's not accessible. These are like, yeah, they should be basic, but honestly I think that like when we think about what work needs to be done and how do you motivate that, I'm quite a big fan of a rights-based approach, and one in which there are real meaty consequences for not stepping up and not making sure that your service is accessible, and that, you know, that applies to the digital element and the offline element. The sorts of things where people, unfortunately these tools are emerging, where people can report what's gone wrong, can hold people to account, can let them know what the law is about accessibility of their service, and there can be consequences to that. It's like we've, like the security situation in the Internet of Things, right? People just didn't want to think about it, and now we have this horrendous mess of insecure devices, even though security should be a thing that you're thinking about from the beginning. And we need like to be thinking about accessibility in the same way as we do about security. It should be there right at the beginning, thinking about how, and there should be real consequences to messing that up. And we obviously need toolkits and support for developers, but yeah, that should go the whole way through. And I think that often private services do it better than public ones, in part because they have the... They have to, yeah, they have to. And also they recognise that a lot of the time, you know, the disabled pound is quite... The people are not like just... You're not just doing this to help them. Yeah. There's people who have accessibility needs, who have money to spend, who have interests to fulfill, who want to book on your flight or use your service. And a lot of the time, if you're thinking about accessibility, you're also going to make your product better for other people, and it's all going to be more intuitive, and your service will work better.
So lessons for everyone there.
Yeah, you should be able to sue people when it goes wrong, but you should also see it as a positive. Is that a paradox? I don't know.
I think so. I'd like to move the discussion on just to another question, which is coming from Harry Evans, formerly of this parish. And so he asks, many people who are digitally excluded rely on their family, network or community to access digital services. So how can services engage, harness these kinds of networks and assets that are already available in the community to tackle digital exclusion? So kind of not just thinking about people as individuals who don't necessarily have the skills or access to devices, but what about the kind of social networks around them as well? Any thoughts on that?
I promise I'll be quick with this one.
Yeah, go on,
but
Lydia.
Keep funding libraries. When I talk to, it is shocking how critical they are now. In terms of that is where people are often signing up to go through these forms, because a lot of our ones do not work on mobile phone. So that might be the only place you can use a computer. And I've heard librarians speak recently about how now that seems to be a huge part of their job. But there's also those kind of digital skills kind of meetup days. There's that's where a lot of the time there's space for you to bring like dad or granddad and lean over him and show him how like the actual computer works and fill in that form. You need those spaces, and you need like people who have time to gather skills and to help. And like this is not, I think, what a lot of librarians signed up for, but those are places where like these kind of spaces, libraries, schools, places where people can discuss and share their skills.
And there's also a lot of them who are really passionate about it as well.
Yeah. And you may have gone into there because you love books, and then this is I've heard from people giving these talks that this is not what I thought being a librarian in a local library would be, but it's extraordinary, and now I am driven to like lead change.
Can I just add to that? A really important point about local resources and local networks and local champions as well from every walk of life. We're doing a project at the moment actually about looking at farmers and how to get farmers potentially online and helping them more in that space. But actually the other group is the public sector workforce themselves. So I think you mentioned it right at the start, we're thinking about actually how can we support our workforce to have the digital skills, the digital capabilities, and also the time and the patience to be able to sit down with someone and help them through some of this if they haven't been on those systems before. So it's not just about drawing on those assets in the community, but thinking of ourselves all as assets and part of the solution to that.
And that's a very sizable workforce, isn't it?
Yeah, it's huge.
In this country. Kwesi, did you?
Yeah, I think just to add an echo what everyone has already said, it's very interesting. In North West London, we've tried to do that because, you're told you've got X to do a digital programme for us to cover the whole population. It won't stretch. So it's about, okay, how do we use and work with existing assets? So libraries was a massive thing. Email the libraries. Could someone come in and just, for an hour a week, just show people something on an iPad or their own device even? Is that okay? More than willing to help, and again, that's free of charge because it's another public sector organisation. So we then started thinking, well, we need to do something sustainable where we are doing something which supports and raises awareness of something like libraries or GP practices. All GP practices in North West London have Wi-Fi. So that, okay, so how can we piggyback onto that, which is a separate programme? That was definitely not one of their benefits or objectives, but how can we benefit from piggybacking something like that? So we have sort of healthy hubs, not in just GP practices, but in health and wellbeing centres in North West London that will start popping up. And to set them up is probably about £500 probably, just because we've been resting on the goodwill of people, of organisations that have space, to get free space and to use existing Wi-Fi and people using their own devices and trying to then build up a way in which, we really can have this threaded throughout society. So it's not just people that are already online, already on Twitter, but those that, like my own grandma, 3 years ago, to get her using an iPad, she was so suspicious of Skype. She's like, how is that actually working? And yet you're seeing someone in another, didn't trust it. It took a long while for me, for members of my family, but now she's using an iPad and Touch ID and doing all sorts and ordering this from her iPad, and she, can't live without it now. But it's, without us being a family or people connected to her, she would never have that. So how do we do that? How do we have like a digital flu whereby we infect people that then infect others digitally in terms of spreading? That wasn't my phrase, that kind of, I wish I thought of that phrase, but and that's what we're into, like a digital flu that it just infects and goes around and it just permeates and spreads, and that's what you want. And again, it has to then, you have to remove yourself out of the equation. This isn't about you or a legacy or what you're going to deliver or where you're going to have your name on a plaque, but really what are we trying to do to help everyone, to include everyone, and it has to step out the realms and confines and constraints of objectives of an organisation.
And David, for me, some of those points just made resonated with what you're talking about, the design processes, kind of sitting with users, understanding how they're experiencing using some of the products and services you guys build.
Yeah, I think it's really important that you as you build these digital services, you make sure that you're testing with users who are representative of the groups that Kwesi's talking about. They don't have to be the actual users. It's better if they are, but they have to be representative. So as much as we might think that we might understand the motivations and the needs of the people who are going to be using these services, we don't know. We don't know until we really do those tests with the people who are representative of Kwesi's grandma and others. And it's very difficult to anticipate what difficulties people are going to have and what experiences they're going to have, because we don't have their context, we don't have their history. And so, yeah, that understanding of the users and testing with them is how we hopefully get around that.
And so there's a couple of questions that have come in that I'd like to summarise, because we're just coming towards the end of our time together. But so one came in that was from Hamish Lang at Swansea University, who asked, does the panel agree that there is both a moral and a financial business case for the NHS playing its part in addressing digital inclusion? And I think this a couple of other things that have come in from the audience, which are really interesting, but focus around this anxiety that digital services are kind of cost-cutting exercises, and so there's a kind of tension there. And whether, when we have this huge reach into our communities on the side of the NHS and other public services, if we just think inclusion and digital skills are someone else's problem, we kind of get the financial benefits, do a bad job of the services, and leave that. So I wonder, is there that business case, just very quickly?
Very brief, short. Yes, I mean, it's something which we speak about each week in the office. There's definitely a moral and financial business case to be doing this approach. Definitely. That's it.
From my perspective, yes, it's imperative that the inequalities, certainly from a moral perspective, is incorporated. The business case, potentially, the biggest concern I have with that is, where's the evidence that it does give you that return on investment? Where's the evidence that it leads to behaviour change? Yes, potentially, but I don't think it's there yet.
Yeah, so we need to kind of build up that evidence base to go behind that business case.
I would absolutely. I'd love to echo the evidence case issue. So one of the reason that there is a moral case for us to do this is that far too often, kind of tools that are supposed to be empowering or supposed to be flexible for people are actually just offloading a lot of the work of managing your managing your health records, or bringing information between specialists, or managing one's own health onto the public, which can work, but only if you give people the skills and the resources and the time and the capacity to deal with that. Otherwise, we're just offloading risk onto people. That's not a shift in power. That's just pushing the risk and effort out. So if there's going to, and that of course leads to strain and the breakdown of relationships and capacity in the longer term. So there's very often, I have a deep concern that many of these tools are cost-cutting or short-term fixes, that because we have the evidence about what your budget looks like this month, there's a strong incentive to cut costs in ways that are very obviously visible, but we do not have great evidence about long-term impact. And we don't capture that much information about informal care or the well-being of people who are receiving care and support services, or while we may have things like the GP satisfaction survey, we don't have a great idea of how a community feels it is being served by health and social care services. So because we don't have evidence of that, one can hack away at those capacities, at the services that support that, or can offload extra work onto people that are already near breaking point, and so may well break down in ways that affect the budget of other services or affect your budget in years' time. So this idea, we have to get a new perspective on the evidence and what these financial cases are, and have sustainability of services and developing community resilience and skills and sustainability over the long term. That's so hard to think about given the current crises, but I'm very passionate about that evidence for the long-term financial and well-being case.
Yeah, David.
And I'm going to repeat a lot of what the guys have said, but I think when it comes to the business case, the answer there, I think, has been really, really clear from the start about what our objectives are and how we're going to measure them, and being very transparent about that with everybody so that we know, this is what we're going to measure, this is how we're going to prove the benefits along the way to make sure that, that backs up both our moral and our financial business case, not just one or the other.
Okay, so thank you to everyone for contributing today. I'm going to invite our panel to just give us, in a very short, in one sentence, can you articulate to people what's the one thing that you would like them to do differently, to understand differently? I think we've ended on a really strong case there, but Kwesi, I'll come to you first.
That digital innovation is not the silver bullet. And that we need to support one another to bring everyone along for the digital journey.
Mine would be beware of a digital inverse health care law. So do look at where there are those opportunities for using digital tech as a solution to health, and not just in healthcare, but just bear in mind that that's not going to be a solution for everybody.
I'd go back to skills. If you're putting more tech or more digital solutions into the public sphere, that means for the recipients of those services and the people working on the front line, a lot more complex, creative, tech support type challenges to solve. So while there's very much a pressure to cut staff costs and invest in digital, because that looks great on the balance sheet, in fact, over the long term, if you're investing in tech, you need to also be investing in people, or like tech without decent support or without decent implementation is just junk, basically. So it's you're not going to be able to cut your kind of workforce in order to get in response to getting tech. It's probably the other way around. But in the long term, that can have such extraordinary kinds of impact on people.
David?
I think I would leave it on sharing expertise, I think, across all of our groups. I think there's so much great work being done here and knowledge both within different organisations within the government here and worldwide, and in the tech sector as well, and in product companies. I think we all have a huge amount of still to learn from each other on this, and I think there are partnerships that can be built to really help further develop in this space. So that's what I would like to see more of in future.
Okay,
so keep up the good work.
Great, thank you. I think those are all really strong points to end on. So I'd just like to thank our panel, and thank you to everyone who's participated today. Join us again for more King's Fund online events in the future. Thank you and goodbye.